Does your child's body seem to work against them? Like they know what they want to do, but their body just won't cooperate? Do they have significant behavioral challenges? Or maybe once they start moving, they literally can't stop? If your child has whole body apraxia, autism, or if they have significant behavioral issues like self-injury, what I'm about to share with you could change everything. There's something happening inside your child's body right now that's blocking the signals between their brain and their movements and the connections to support regulation. What is it? Well, I'm going to share it with you throughout this video. The good news, there are practical science-backed strategies that you can start doing today to help clear that pathway and improve your child's ability to have more control over their body. I'm going to break down the science in a way that actually makes sense, and I'm going to give you action steps that you can implement immediately. Hi, I'm Dr. Dana Johnson. I'm an occupational therapist with a PhD in child mental health and development. I also dove deep into functional and nutritional medicine because I kept seeing gaps in how we were helping our kids. For almost 20 years now, I've been working with families who have children with complex autism and whole body apraxia. And I've seen significant improvements in many of my clients when they address what we're talking about today. Inflammation. Okay, so here's what we are going to cover: what inflammation actually is and why you should actually care about it. I know it's easy to say this isn't relevant to my child, so I think I'm going to skip this video. Well, I encourage you to hang in there because I am more than sure that your child has inflammation in their body right now, and that is affecting their ability to move, communicate, regulate, and progress in their therapies. We're also going to talk about how your child's gut is affecting their brain and movement. Now, I know again, another reason why you might want to skip this one. Many parents will say, well, my child's gut is fine, or we've done all the things, but nothing seemed to work. Well, hold on, because you may not have done everything. And finally, we're going to talk about why inflammation blocks intentional movement and affects regulation and what you can do about it right now. Okay, so let's start simple. Inflammation is your body's alarm system. There are two types. We have acute inflammation, which is actually your friend. For example, when your child scrapes their knee, it gets red and puffy for a few days, but then it heals. And that's exactly what the body should be doing. Now, chronic inflammation is actually the problem. Imagine a fire alarm blaring 24/7 when there's no fire. Your child's body stays in constant emergency mode. That creates chaos everywhere, especially in the brain. Now, here's what really should matter for parents. Research is now showing that chronic inflammation in the brain, which is called neuroinflammation, directly interferes with motor control. Now, I'll link more of those studies below in the description. Think about it like this. Your child's brain is trying to send a text to their hand saying, pick up the spoon. But inflammation is like having one bar of signal. The message gets delayed, garbled, or doesn't even arrive. The ability to move is there, but the wiring just has interference on the line. Now, you probably heard about the gut-brain connection. Well, get this. Upwards of 90% of individuals with autism have some disruption in their gut. No joke. I will actually link the articles below. Now, here's why it's critical for movement. There's a superhighway called the vagus nerve that runs between our gut and our brain, constantly sending information back and forth. It's processing things like digestion, regulating mood, controlling inflammation, and managing stress all at once. When there's chronic inflammation in the gut or the brain, it's like a massive traffic jam on this highway. Signals get blocked, delayed, or completely scrambled. So what causes gut problems? Well, it's called gut dysbiosis, and that's when the balance of good and bad bacteria gets totally thrown off. So what triggers it? Well, things like antibiotics, which I know are sometimes necessary, but they also wipe out that good bacteria. Other medications, or chronic stress and anxiety, or things like diet and environmental factors all contribute to gut dysbiosis. Now, here's the kicker. This often starts incredibly early, sometimes even before birth. When the gut is inflamed, it sends distress signals to the brain. And when the brain is inflamed, it affects gut function. So it's a loop that keeps feeding itself, and your child's motor skills are caught in the crossfire. Okay, so here's where it gets interesting. Let me talk about what's happening in your child's brain. At the back of the brain sits what's called the cerebellum. Think of this as a conductor of the orchestra. Every time your child reaches for something, takes a step, or brings food to their mouth, the cerebellum is coordinating hundreds of tiny muscle movements to make it happen smoothly. But it does even more. Things like attention, language, problem solving, emotional regulation. The cerebellum is involved in all of it. And here's what research shows. Neuroinflammation during development can damage specific cells in the cerebellum, specifically called Purkinje cells or Golgi cells. These are the electrical wiring of motor control. So imagine building a house where some of the electrical wires never get installed during construction. The blueprint is perfect, but the connections simply aren't there. So what causes this damage? Well, when your child is exposed to toxins, infections, or chronic stress, even inflammatory triggers during pregnancy, the immune system releases what's called cytokines. Now, think of these as panic texts flooding the system. Emergency, emergency. And when the brain gets overwhelmed by these messages, it activates the brain's immune cells called microglia. Now, normally, microglia are helpful cleanup crews, but when they're constantly activated, they start causing more damage instead of helping. So the result? Well, difficulty with motor planning or knowing the steps to complete the action. Problems with motor execution or actually doing the movement. Trouble learning new movements or imitating others doing movements. And finally, poor visual motor integration like catching a ball. The inflammation actually disrupts synapse formation, and these are the points of connection where the brain cells talk to each other. It's like having spotty cell service. You're trying to make a call, but the connection keeps dropping. This is the brain-body disconnect. This is whole body apraxia. Okay, so here is why I just went through all of this information. When you understand what's happening, you can actually target your support way more effectively. So let's talk about solutions, practical research-backed strategies. First, supporting the gut. If your child has frequent GI issues like constipation, bloating, pain, or diarrhea, please see a specialist who understands neurodevelopmental conditions like complex autism. Now, I'm going to link a few experts in the description below, because this isn't just about reducing the pain or discomfort, it's about reducing inflammation at the source. Consider prebiotics or probiotics, food for the good bacteria. Things like bananas or yogurt, or if your child struggles with food in general because of food sensitivities, try a quality supplement. And then water. So many kids are chronically dehydrated. This alone can help with gut function and inflammation. Secondly, movement is medicine. Yes, exercise. I know it seems counterintuitive when movement is the struggle, but here's the thing. Exercise reduces chronic inflammation. Plus, it supports detoxification, improves cellular energy, regulates the nervous system by providing sensory input for body awareness, and enhances motor learning. And it can be any type of movement, walking, climbing a playground, or riding a scooter. Third, prioritize sleep. Inflamed brains struggle with sleep. A poor sleep worsens inflammation. It's a vicious cycle. I know sleep is sometimes already a massive challenge for many of the families that I work with. So try things like having a consistent bedtime routine, reducing the screen time before bed. Consider having blackout curtains or white noise, and address inflammation through other strategies, some of the things we're talking about here, because with these things, sleep will then naturally improve. And lastly, omega-3s for brain health. Now, I know I said before that food can sometimes be tough, especially for sensory challenges, but omega-3 fatty acids have powerful evidence for reducing brain inflammation. Try things like nuts or flax seeds, and you can even put them in a smoothie. But if food is a battle, then a high-quality omega-3 supplement is a solid option. Now, here's what I want you to remember. Whole body apraxia isn't just about practicing movements. symptoms. There's often something deeper, inflammation, creating interference between your child's brain and body. Now, the amazing part, when you address inflammation, you're not just helping their motor skills, you're supporting their entire system, their mood, their learning, their comfort, and their progress. This is a journey. Every small step reduces the inflammatory load and clears the communication channels. If this video helped, please hit the thumbs up and subscribe for more content on whole body apraxia and neurodevelopmental support. And drop a comment. What has worked for your child to reduce inflammation? And lastly, be sure to share this video with someone who needs to hear this information. Thank you, and I will see you on the next video.